welcome back for another Sheriff of Sodium video. This is going to be a little different than most of my usual content, but lately I've sort of hit my limit with a certain kind of foolish talk, and I'm hoping that if I rant about it for half an hour or so, I'll feel better. I don't know. I guess we'll find out. And let me just say from the outset, I know who I'm talking to. This channel has an unusually intelligent and curious and observant medical audience, and for that I remain grateful. So you guys out there, you already know that AI is going to replace most doctors in the future. But elsewhere, many of our arrogant and foolhardy colleagues continue to scoff at this fairly obvious prediction. They say that AI could never replace what they do. They're big, self-important doctors running bustling clinics and rounding on busy inpatient services and clearing the queue of radiology studies. No, they say, AI could never replace me. Why, in fact, AI is only going to augment what I do. It can't do what I do. It's only going to help me do what I do more efficiently. AI is not going to take these doctors' seats. It's just going to sit alongside them and make these smart guys even smarter. It's going to make their workday easier because AI is going to handle some of their scut work and leave the real doctor stuff for the real doctor. AI is not going to compete for their salary. Actually, it's going to make these smart guys more money because it's going to increase their throughput and help generate better notes and billing codes and generate better reimbursement rates. And probably, actually, AI is going to save them some money too because although they are not replaceable, you know, some of those lazy ancillary and office staff are, so they're going to get replaced with bots, and these smart guys are going to lower their practice costs too. And if that doesn't already sound silly to you, why don't you listen to it again? You think that you're going to use AI to manage referrals and streamline your pre-registration process and AI to schedule your patients, and then when the patient comes, you're going to use an AI scribe to write most of your note before you even leave the room. And then, of course, you're going to need to use AI to come up with a diagnosis and treatment recommendations, and probably you'll use some more AI to write that after-visit summary and patient instructions. And when you leave the patient room and you sign back into the EMR, you're undoubtedly going to be pleased to see that AI has already answered all your patient messages in your in-basket. And then you'll use AI again to optimize the note that got started before because you want to upcode it and get the maximal reimbursement from payers. And, you know, any side work that gets generated from that visit, like DME or home health orders or prior authorization requests, well, you're going to use AI to power through those too, right? So you, the smart doctor, you're going to be sitting at the helm of a vast army of chatbots and large language models that have all just been optimized to help you gainfully perform your job. You, sir, are going to be at the apex of a vast clinical pyramid, just able to extract rent from all those who sit below you. By virtue of your degree and training, you will be able to insert yourself permanently as healthcare's indispensable middleman. And it will never occur, not once, ever, it will never occur to the smart entrepreneurial people who made all these AI tools that they could simply cut you out. Now, does that sound like something that's going to happen? No, it doesn't. And it shouldn't, because even if you don't know a thing about AI or medicine, if you know anything about economics and incentives and human behavior, it should be painfully obvious to you that the substrate and driving forces to replace most doctors with AI, they already exist. And really, all it takes for it to actually occur is for a few little guardrails to come down. But that doesn't keep some people from clinging to this idea that they're going to have a long and lucrative career as a bot master, serving as the intermediary between AI and patients. And there's all kinds of comebacks and counterarguments, and some of them are sillier than others. Let me dispense with one of the sillier ones right now, which is that your doctor job is way too complicated to be replaced by AI. And before you go wild in the comments and tell me how complicated your job is, I'm once again asking you to engage in just a moment of honest self-reflection. This is a safe space. We can be frank with each other. It's true that medicine, when it's practiced at its highest level, It's one of the most beautiful human intellectual achievements, and it's not easily replaced by a machine, okay? We can agree on that. But it's also true that the vast majority of individual medical decisions are just not that hard. BP up? Okay, me prescribe BP down medicine. Potassium's low? Me give potassium, make number higher. Oh, your patient's out of diabetes medicine. Me click button, refill diabetes medicine. Where's that tube on x-ray? Oh, me see it. Man has no poop after surgery. Me give bowel regimen. I don't care what your specialty is. You're not House MD, spending hours and hours every day pondering over medical mysteries that no one else could figure out. You're just not. Most of what you do, I'm not saying it's not valuable, but it's straightforward. It's templated, it's logical, and it could be easily accomplished by an AI bot. And I don't mean some hypothetical, super advanced AI bot in the future. I mean it could be done by AI right now. And AI can do it, and not just do it, but do it better than you. I mean, who do you think is more likely to miss a drug-drug interaction, you or a robot? Who do you think is going to be faster at returning messages? Who do you think is more likely to overlook a change in an inpatient's vital signs? Who do you think is going to do better at recommending all the preventative screenings? Who do you think is going to more consistently hit every element of the pre-op H&P? But I do procedures. Yes, I understand. And I agree. I think we're still pretty far away from having bots place your art line or take out your gallbladder. I'm not saying that AI is going to deliver the baby or replace your hip. But even if you're a proceduralist, you still spend quite a bit of time doing things that could be replaced by AI. I'll link in the notes below to a paper that found that the average surgeon spent around 450 hours per year doing operations, which amounted to 22% of their work time. And I'm sure there's very wide variation on that figure. So maybe your actual number is 32% or 52% or maybe even 72%. But you're still leaving a lot of work for a bot. And maybe the bot makers will simply provide those services that maybe you aren't even really that fond of doing anyhow. And maybe the generous corporations that employ physicians will just say, "Thank you, bot." And they're going to give all that time back to you as a proceduralist, and they're going to let you keep all the money too. Or, I don't know, maybe the people who make the bots or run the hospital, maybe they have a different business model in mind. And if they do, maybe it's going to put an economic pinch even on people who think that their job is AI proof. But patients want human doctors. Again, I think this is true. But it's true under a certain set of conditions. And so before you parrot this objection back to me, I think we should think together about what the limits of those conditions are. So let me give you 3 things to think about. Yes, people like human doctors, but you know what else they like? Convenience. And human doctors, in general, they don't like to work overnight or on holidays or at odd hours when they could be with their families or doing things that make their lives meaningful. But bots don't care about that. They can work anytime, any place. Now, I'm sure if you did a poll 30 years ago about whether people liked their bank teller, I'm sure many folks would have said yes. But once you gave customers a realistic choice and let them decide, do they want to disrupt their whole day's schedule and rush to the bank before it closes so they can stand in line to deposit a check? Or do they want to just go to the ATM whenever it's convenient? I mean, what do you think happened? I'm certain there will always be some patients who will insist on seeing a human doctor. I mean, my mother-in-law still uses a travel agent to book all of her travel. But for most of us, we've learned to trust Expedia and Priceline and Airbnb and Hotels.com, and this kind of convenience is hard to overcome. And that leads to a second point. You know, the group of patients that have the greatest contact with the healthcare system are older folks. And older folks right now are people who spent the majority of their lives doing things without computers. But it's very reasonable to assume that that's going to change as we have more patients who are comfortable with technology, and especially as AI infiltrates every part of the human experience and the average person learns to trust and depend on it for all kinds of things in their lives. I think attitudes are going to change. And there's a third thing to consider too. It's one thing to have a preference for a human doctor if you're assuming a world where human doctors cost the same as a bot. But if the price of the bot is much lower, which it will be, then that calculus changes. But what about empathy? Again, I agree. I don't think patients want a chatbot to tell them that they have cancer, or may never walk again, or need to start dialysis right away, or it's time to pursue hospice. But if you think that this is going to keep AI from replacing doctors, I think you might be underestimating how empathetic chatbots can be. Here's an interesting study that came out in JAMA Internal Medicine a couple of years ago and compared a now antiquated version of ChatGPT to the altruistic doctors who were answering questions on a Reddit patient forum. Now, on these graphics, the blue curve is the doctors and the gray is ChatGPT. So notice on the left how the average ChatGPT response was higher quality than all but the very best physician responses. But actually, what I want you to notice is that distribution on the right, which is empathy ratings. And there, it's not even close. ChatGPT was way more empathetic. And I admit, this is an online forum, so yes, the doctor's body language and physical presence, those things couldn't factor in. But I'm not trying to have journal club here. I'm trying to show you this to make a point, and that point is this. There's a lot that goes into a patient's perception of empathy. But one key ingredient is time. I mean, we can imagine the ideal physician patiently sitting at the bedside and holding Mima's hand. But honestly, how often do you see that? Many physicians are burned out. They're stressed and they're under time pressure and they don't have the emotional space. And even if they did, they don't always have the time or won't always make the time to show compassion. But chatbots, they have all the time in the world. So by this point, I think you'll agree that you, or at least most of what you do, can or could be replaced by AI. If you're not convinced of that, I don't really know what to tell you. I mean, you can stop watching the video right now. You're like some kind of medical John Henry, holding your sledgehammer and talking about how you're always going to be better than the drilling machine that this very second is chewing through the mountain right behind you. Or I don't know, maybe you're like some guy who's made a great living running the horse stable before automobiles existed. But now you see all these newfangled Model Ts coming down the road and you get downright giddy thinking about how great this is going to be for your business because now it's going to be so much easier for people to get down the road to the stable and buy a horse from you. Or maybe you're something else. I don't know. So if you won't listen to me, I don't know. Maybe you'll listen to somebody else. Maybe you'll listen to billionaire venture capitalist Vinod Khosla. He thinks that machines are going to substitute 80% of doctors in the future, and the healthcare economy is going to be driven by entrepreneurs, not medical professionals. Maybe you'll listen to Bill Gates. You think he knows anything about where tech is headed? I don't know. Maybe the man's picked up a thing or two along the way. Anyway, he thinks that AI is going to replace most doctors in 10 years. And what these people realize is that the technology is largely there, and more importantly, the incentives are there to make this happen. The only thing keeping it from starting to happen right now are a few little logistical and regulatory hurdles. So let me address some more of those objections. But bots don't have a medical license. And this is a key point. It's not that doctors are the only entities that could possibly understand that a patient with pharyngitis and a positive rapid strep test should be treated with amoxicillin. It's that licensed health professionals are the only ones who can prescribe the medicine, and they're the only ones with an NPI number that they can list with an ICD-10 and a CPT code so they can be generously compensated for having such remarkable clinical insight. But will that always be the case? I don't know. Earlier this year, a congressman from Arizona introduced a bill titled the Healthcare Technology Act of 2025 that would allow AI chatbots to be recognized as practitioners who could prescribe drugs under the Federal Food, Drug, and Cosmetic Act. Now, this bill didn't go anywhere this time. But I think as time passes and our comfort with and respect for AI grows, this kind of proposal is going to pick up more and more political champions. And in fact, I'm going to go ahead and tell you who those champions are going to be. But first, if you'll permit me an aside, there are many people who think that radiology will be the first specialty that's largely replaced by AI. Of course, people have been saying that for years, and it hasn't happened yet. But Professor Geoffrey Hinton, who is a Turing Award winner and is considered the godfather of AI, he has said that it's, quote, quite obvious, end quote, that we should stop training radiologists. And he once described radiologists as, quote, the coyote already over the edge of the cliff who hasn't yet looked down, end quote. There are others that have their eye on dermatology, since we already, right now, have computers that can diagnose melanoma with near 100% accuracy. But I actually don't think that either of those things is where AI is first going to get a foothold. I think it's going to be in outpatient primary care. I say that because of the physician shortage. Now, regular viewers know that right now, as I'm saying that, I'm holding up my fingers in big air quotes, because I'm highly skeptical that we have a physician shortage on any scale in this country. Instead, what we have is a maldistribution of physicians and an incentive system that leads many patients to struggle to access care. And this makes it easy for people who want to open a new medical school or a residency program or lower the standards required for medical practice to make a convincing argument for what it is that they actually want, as long as they gesture vaguely in the direction of patients who have real problems accessing care and say, physician shortage. Because then they can suggest that whatever it is that they actually want to do, it isn't driven by their own economic incentives, it's going to help these poor people. And this is why we'll see AI truly replace doctors first in primary care. Because there's a ready-made, well-rehearsed argument. And honestly, there's a need. There are real patients who suffer because they don't have a primary care physician. There are entire communities that have no doctor and no realistic hope of recruiting one anytime soon. These people would benefit from AI, and it won't take much for AI companies to convince lawmakers of that. This is a much easier political argument than trying to replace radiologists, because despite all the hot breath expelled talking about how we have a shortage of radiologists, everyone's films are getting read. It's not like there's some backlog of CT scans sitting in rural Appalachia that no one has the time to read. Yeah, it may be hard for a hospital to recruit a radiologist at the price they want to pay, but in general, the work is getting done. It's getting done in a timely fashion. And, oh, by the way, radiologists are pretty good at their jobs. Their reports are mostly correct. So in the year 2025, if you want to get full practice authority for your bot and overcome some of the likely sources of resistance that we highlighted earlier, you would have to show that AI was convincingly better than radiologists. And that might be hard. And actually, it's going to be even harder now because many radiologists are already using AI to improve their reads. So your product to replace radiologists wouldn't just have to beat radiologists, it would have to beat AI augmented radiologists. So now compare that situation to primary care. If the alternative is having no doctor, how good does AI have to be? I mean, you don't have to beat a primary care physician at their apex, coordinating complex care and building encyclopedic knowledge about individual patients in their panel. All you'd have to do is beat the null hypothesis of patients receiving no care. And if all you did was put a robot in a room with a nurse and a blood pressure cuff and a phlebotomist, you might not be able to help everyone, but you could certainly help a certain number of patients live longer and better. And once that door opens just a crack, once you allow a bot to replace a primary care physician, the floodgates are going to open to fill other needs, and not just needs for society, but needs for corporations and consumers. Think about high-end primary care. I mean, many people generously pay for direct primary care physicians or concierge physicians. What if you could give them an AI doctor with true 24/7 access? No limits on appointments, no limits on phone calls, and it'll cost, 50% of what they pay now. You think you get some takers? And, oh yeah, you can make money in other places too, because you could integrate your AI doctor with your whole body MRI or your vitamin shop or your personalized medicine genome evaluation or other wellness services once you get people in the door. What about urgent care? One of the surprising health stories last year was seeing Walmart and Walgreens and CVS scale back or discontinue their plans to put clinics in their retail space. Why did they do that? It was a business decision. The overhead costs were just too high. These stores were better off just using their space for another row of seasonal items. But an AI doctor would substantially lower the overhead. It would cost just a fraction of a physician or even a nurse practitioner or physician assistant. And an AI bot, it doesn't need benefits or need an HR manager to keep up with its hours. So you're going to see AI doctors there too, and there will be very little resistance because taking these kind of jobs is very non-threatening to physicians. Another thing that'll be non-threatening to physicians, at least at first, is to let these AI doctors work as additional coverage. With some loose physician oversight, of course. And this applies to multiple specialties, not just primary care, because many hospitals really struggle to cover essential nighttime services. In academic medical centers, you have big faculty groups, plus residents and fellows to share the load and take first call. But in the community, if you're the surgeon or the intensivist or the obstetrician that night, it's you. And you might be on call again the next day. And the people that are calling you, they don't know that or care about it. And you're going to get called about all kinds of things, some of which demand your full attention, but many of which don't. I already said AI is not going to deliver the baby, but could an AI doctor handle some of your triage and decide when it's time to wake up the obstetrician? Maybe. Could an AI doctor patrol the ICU and monitor vitals and put in simple orders for sedation titration and electrolyte repletion? Maybe it could, and that'd be good. It would fill a need for hospitals and doctors, at least at first. But once the bots can make decisions and put in orders, there will inevitably, in time, be edge cases where all of a sudden the hospital doesn't have a physician to cover. And the patients, they'll be better off with the robot doctor instead of nothing, right? And so they'll come up with a workaround or advocate for a workaround in which the supervisor could be maybe one step more removed, and we'll just let the bot have at it. And guess what? The bot's not going to complain. He's not ever going to get burned out from taking extra call. My point is, yes, now there are currently guardrails that keep all this from happening, but once AI bots break through and get the authority to prescribe and write orders and bill for their services, nothing else will matter. So how about another objection? But AI hallucinates. Yeah, AI is not perfect. It makes mistakes. So do human doctors. The thing is, when AI makes a mistake, it's a different kind of mistake than what a human would make, so to us it seems especially silly. But be honest, hallucinations and all, who do you think would have a higher error rate on routine physician tasks right now? Real doctors or AI? And what do you think? Now, that doesn't mean that society is going to have the same tolerance for automated mistakes versus human errors. I think we've seen with self-driving cars how that plays out, where the technology gets held to a much higher standard. But even then, this to me is a silly objection because it seems to suppose that this is a non-overcomable problem instead of a bug that's going to get worked out relatively quickly. I think the proof of concept for AI in medicine has been demonstrated. The rest is just engineering. But what about patient confidentiality? Yes, there are regulations that require data privacy for health information, and it's true that today's chatbots are not HIPAA compliant. But let me just tell you, of all the tenuous arguments about why you don't need to worry about AI replacing you as a doctor, this is the most tenuous. In fact, I would put it to you that if you hear someone making this argument, it's actually a tell that they're fully aware that AI is going to replace doctors, and they're probably actively working on it right now, but they're just trying to put a little pacifier in your mouth so that you'll stop crying about it. You walk into any hospital, log on to the computer terminal, and you will be confronted with a cornucopia of clunky legacy software programs that are all HIPAA compliant. So this idea that it's just somehow beyond the capabilities of an AI maker to figure out how to incorporate end-to-end encryption or make a business associate agreement, it's just silly. But what about liability? Because right now, doctors make decisions and they have to be responsible for those decisions, and they can be sued by patients for negligence. So who's legally accountable when AI makes a bad decision? The developer, the hospital, somebody else? People who cite this objection, they think they're real clever. But the flaw in their reasoning is that they're looking at this from the view of an individual. If you're an individual doctor, I mean, if you're the guy, the gray-haired senior physician sitting in the doctor's lounge watching Fox News and holding forth about defensive medicine, it should be self-apparent that you should never be stupid enough to willingly put yourself on the hook to be sued. I mean, why would you ever do that, right? And for an individual, that's probably sensible advice. But it's not always sensible advice for a company because, let me ask you this. I mean, doctors and hospitals get sued every day for all kinds of things, some legitimate and many not. We've got a whole entire med-mal industrial complex built up around this of plaintiffs' attorneys and defense attorneys and insurers and actuaries and whatnot. Does that keep doctors or hospitals from making money? No. I mean, in general, no. Instead, having malpractice insurance and putting in place reasonable safeguards against being sued, it becomes part of the cost of doing business, and that is how AI companies will see it. It would be nice for them if someone else would take on their liability, but if no one volunteers, they're still going to see it as there's more money to be made by making robot doctors than there would be if they didn't. So what they're going to do is they're going to advocate for indemnification structures. And guess what? The trial lawyers and American Association of Justice lobby, they're going to be happy to work with them, even if they have to negotiate malpractice caps. Do you know why? Because the lawyers will do better in the long run if they have the ability to sue AI companies and hospitals than if they don't. It's a business decision for them too. And the same thing's going to go for the insurance companies who they'll figure out how to underwrite AI malpractice policies. So all of this, it may take a while to work out. But work out it will, because the incentives are there for all parties for it to be worked out. It's just a business decision. And ultimately, I think that is what you should take away from this rant if you're still unconvinced that AI is going to replace you. If you want to predict the future, the proper way to analyze it is to evaluate the incentives in play, and then evaluate the power and leverage that each player has. And when you do that analysis, it should be painfully obvious to you that you, or much of what you do, will be replaced. And if that sounds depressing or makes you sad, I'm not here telling you what I want to happen. I'm just telling you what will happen, so don't shoot the messenger. But I guess before I close, I should spend the last few minutes trying to answer the question of, given that all this is coming, what should medical students and residents and doctors do to prepare for it? How can you AI-proof yourself and your career? And I'll be honest, I don't have the answer to that question, and I don't know that anyone else does either. But I think the right framework for answering it is to think about, number one, what can't AI do well? And number two, what things won't society allow AI to do, or at least allow it to do unsupervised? Because if you lean into those two things, I think you're going to have much more job security in the future. So if you're still in the process of choosing your specialty and there's multiple areas in which you could see yourself being happy, you probably should consider how AI resistant each specialty is. So think specifically about how much of the work in a given specialty can be automated and how easily that kind of automation might be implemented and what the incentives for implementing it would be. So I put together some loose rankings here. You can see toward the bottom of the screen I've got radiology and pathology and dermatology, because anything involving visual diagnosis and pattern recognition are going to be targets for machine learning. And as I mentioned, we have algorithms right now that can do some of these things and do them pretty well. And I have outpatient medicine in general and primary care specifically down there because, as I said before, politically that is the easiest target. And if AI corporations can get that domino to fall, the rest will come tumbling down in short order. And then in the middle of the list, I've got things like anesthesia, where, it's very hard to imagine a bot performing the technical skills, but it's very easy to imagine one that could do the intraoperative monitoring and management for routine, stable cases. Same kind of situation for OBGYN. A bot's not going to do the delivery or perform surgery, but it could capably manage routine prenatal care and screenings probably. And then at the top of the list, I've got the surgical specialties where there's a high dependence on manual and technical skills, and many preoperative and intraoperative decisions are based heavily on nuanced clinical judgment. And although it should be obvious, I don't want anybody's butt to get hurt, so let me state on the record that this list is not a ranking of the smartest or the best doctors. It's just my opinion, informed by the factual observation that machines are better at doing certain things than other things. And so if you're the kind of person who enjoys doing a lot of different things equally, you might want to avoid doing the things where you're going to be directly competing with a machine. My next piece of advice would be to develop human skills. Let me try to explain what I mean. A couple times a year maybe, I get to have this pleasant and flattering experience where I come in to consult on a patient who's still a diagnostic mystery, and I get to figure it out, and I get to tell the residents or the primary team whatever it is that they have. And when that happens, someone will tell me how smart I am, which is very nice, but honestly, it's not quite true. What almost always happens in these situations is that I got a better history than whoever it was that came before me. It's not like I was taking the USMLE and I knew the answer to a question that everyone else saw the same question and nobody else knew it. It's that I got a substantially easier question stem that had more information in it, and it was easier for me to answer it because of that. Now, why did that happen? I mean, maybe I had more time, or maybe I picked up on their nonverbal cues, or maybe I asked a question to the other person in the room. I don't know. And I don't mean to say that I'm the gold standard. I'm not. There are many, many cases where I've missed things or been rushed or have failed to win the patient's trust to get that extra information that would have helped you nail the diagnosis. My point, though, is that these skills matter. An AI bot is only as good as the information that's fed into it. And sometimes patients give up all the relevant information easily, and sometimes they don't. Given the same set of facts, an AI bot is going to be smarter than the doctor 90% of the time. But you have the potential to get better facts. Bots are great at pattern recognition and structured tasks, but they're not good with building trust or navigating emotion or picking up on subtle social cues or contexts. So what you need to do is get good at those things. Same thing goes for the physical exam. You can make, and I'm sure someone is, a closed loop system where every single record and data point in the EMR gets fed straight into the bot. But unless you CT body every single patient, there's some stuff that you're gonna get from your hands and your eyes. The chatbot's only going to know if there's hepatosplenomegaly if you tell it that. It can only consider the significance of an enlarged lymph node if you found it. So you need to get good at these things too. Here, I'm going to tell you another story. Not long ago, I was chatting with a colleague about AI, and they were telling me about some medical students who had missed a required preclinical lecture. I don't know what it was on, but it was something about history taking or the physical exam or one of those the kind of things that you take in your first year or two of medical school. The kind of stuff that's low yield for USMLE Step 1. Anyway, these students missed it, and it was required, so their makeup assignment was to review the lecture materials and write up a brief review of the salient points, not a big lift. So you know what all the students did? They used ChatGPT. I don't know what to tell you. AI can already pass the USMLE, brother. If you can't do anything better or more efficiently than it can, you're going to be the first person who gets replaced. And that actually leads naturally into my next point. Use AI judiciously. You got to use AI. You got to learn how to use it well. These are key skills for future physicians. If you don't have them, you're going to struggle. If you have them, you'll be smarter and more efficient. But you got to know how to do some stuff on your own. So the last word on the screen there really is key. If the way that you solve every problem is to just ask AI, you're not providing anything that anyone else can't provide. In fact, you're creating a harmful dependency that's going to intellectually hobble you. The better you are at doing stuff, the better AI can help you do that stuff. But you got to know how to generate a differential, or make a diagnosis, or write a manuscript, or draft a personal statement, or formulate a convincing argument, or reason your way out of a paper bag. You got to be able to do that on your own, because that's the only way that you're going to be able to add value beyond a bot's default settings. So don't cheat yourself. I know your time is pinched. But your time in training is where you turn your brain into a beautiful instrument that has the potential to make patients' lives longer or better. And this beautiful instrument allows you to be generously compensated in the marketplace. And using AI is one skill among many that you need to master. But you're not being more efficient or beating the system by having AI do everything for you. I mean, you might as well send ChatGPT to the gym to do your workout and pat yourself on the back for saving an hour every day. Last, build complementary skills. I'm thinking here about skills in leadership or ethics or law or policy. Because AI doesn't have a moral code, and what it's allowed to do is going to be determined by lawmakers and policymakers. So if you understand these systems, I think you'll be prepared and well positioned to take a leadership position in managing some of the massive change that's coming very soon. If you've stuck with me for this long, I guess I first got to say thank you for letting me get all this off my chest. I actually do kind of feel better. But since I kind of wandered around and covered a lot of ground over the past half hour, I want to make sure that I've clearly communicated my key points, and really there are two. The first is that if you're a doctor, AI will take your job. Honestly, in many ways, it could take your job right now, but there are still some policy and administrative guardrails in place that will keep things more or less as we've known them for a while longer. But those things are eventually going to come down. In the future, I will put it to you, you simply will not be able to practice as an AI jockey, and profitably insert yourself as a middleman between the patient and the AI that's actually making the decisions and doing the work and adding value. The long arc of the market is much more efficient than that. My second point is, if you want to add value in the new healthcare economy that is absolutely coming, you're not going to do it by outperforming AI in the things that it's really good at. You need to have some fundamental skills in those areas, because without them, you're not going to be able to see the AI's blind spots. But really, you also want to work to cultivate traits that AI can't replace. Procedural skills, clinical judgment, comfort with uncertainty, cultural competence, communication, humor, humility. These are things that matter to patients and healthcare teams, and they're fundamentally human skills that no AI bot has. That's all I got for now. As always, thanks for listening.